So the vast majority of sinus infections are caused by a viral illness. Classic common cold, but I can also see it with following flu, and I've also seen it following COVID. So probably that's 85% of sinus infections are due to a viral illness. The other 15%, the next most common would be an allergy flare-up. So that's probably the second most common. Third and fourth would be if there's some anatomical issues such as nasal polyps or septal deviation, and then pretty rare if a patient's immune deficient, either being on chemotherapy or on some immunosuppressive drugs. So how do you know if you have an infection? Well, the symptoms are different with everyone depending on their anatomy and their underlying physical health. The classic story for me is a patient who's had a cold and it's been going on for over a week and they've tried everything over the counter and they're still having symptoms. A sinus infection can present in many different ways. I've seen patients just with their ears plugged. They'll just have a sore throat. They'll just have a dry, hacky cough. They feel pressure in their throat. They'll have a headache, tooth pain, lack of smell, lack of taste. So everyone's different. And I've actually had patients who did not even know they had a sinus infection. They went and had an MRI of their brain for whatever reason, or they had a dental x-ray, or they had a CT of their neck, and it turns out they have a sinus infection. And they didn't even realize that they had the infection. They weren't having any symptoms. And then I go over the films with them, I go over their anatomy and treat them, and when we see them back, they say, wow, I didn't realize that I had an infection. I had a cold 3 months ago and wasn't feeling well. I was a little tired, but I didn't realize that I had an infection. So it does present very different with everybody. Occasionally you can have a fever. So if you get a secondary fever several days after a cold, that's concerning that you may have developed a secondary infection, such as in the middle ear or in the lungs.